The morning of your surgery, you're going to get up and you're going to take medication only if they tell you to. There may be a couple medications occasionally that you get to take. Otherwise, hold off on everything. Don't get up and eat breakfast. That would make your surgery not happen that day, okay? And show up before your scheduled time. So if they tell you your surgery's at 9 o'clock, don't show up at 9 o'clock. Show up at whatever the pre-check-in time is, so 7:30 or whatever. And come into the main entrance of the hospital, the new one with the fireplaces where the registration is. Sit down, meet with the lovely people at registration. They'll get you checked in, give you some bracelets, and then direct you to the hallway behind the desk, which is known as the longest hallway in Port Townsend, okay? When you look down it, you're gonna be looking, there's light coming in from the courtyard of the, where the cafe is. Keep going down that hallway, and at the very end of the hallway, there's a double door. The left says imaging, and the right says surgery. So you hang a right, go past the elevators, and as you look up in the ceiling on the left, you'll see the surgical check-in, which is another double door, closed. Open the door, don't be shy, and go in, because they're going to be waiting for you. Okay? Then they'll help you get prepared. You get one of our lovely hospital gowns, get to put on one of the bracelets. They'll make sure it's really you and that you didn't send your neighbor for surgery instead. Go through all those same questions again. The anesthesiologist will come in. You'll have a parade of people. The doctor, the PA, all kinds of people are going to work with you, get you ready, talk to your family too. And when it's time to go, they'll let your family go wait out in the waiting room. And the next thing you know, you'll probably be waking up and thinking, how did this happen so fast? Okay. So after you get through the recovery area, you come up the elevator one floor, and voila, there you are on the 3rd floor. So it's really nice when I get to do this class live because I can offer you a tour so you can see what the hospital is like. Hopefully most of you have visited at some point somebody there or have some awareness of the hospital. It's a really nice setup. Under normal conditions, all the rooms are private. They have their own bathrooms. In a perfect world, everyone gets a view because we have all these lovely rooms on the water side. And you get to view the beautiful Port Townsend Bay and Harbor during your stay, which I think is very therapeutic as well. And it's a really lovely setup. Quite quiet, actually, for a hospital. Okay, so you'll come up. Nursing will be monitoring you, getting you checked in, and then you get a visit from your lovely neighborhood physical therapist who comes in and starts checking you. Okay, so I'm going to be coming around and be looking, checking to see if your spinal is wearing off, how you're feeling, what your readiness is to be able to get up and get out of bed. Because my preference is to be able to work with everybody the first afternoon, and that's really important for that synovial mechanism we talked about earlier, but also prevention of other things like pneumonia, blood clots, and other complications that go with potentially having surgery. Okay, so typically physical therapy will see you the afternoon of your surgery, just once. And what we do that day is we don't go for a walk. We'll get you up, sit at the edge of the bed, stand up, use the walker. If the timing is right, get you up for dinner. Okay? I'm a stickler for having people be up out of bed for all meals. Okay? So my purpose always is to get you up. And my reasoning is that, well, there's so many things. You breathe better there, you're working your core, your body is active. It's so much better for moving things through your gut, okay? And that's so important. We want you to be having normal functioning there as quickly as possible. After that, physical therapy will see you 2 or 3 times a day. I'm going to keep you pretty busy. Your day after surgery is actually your busiest day. You'll typically have a walk before breakfast, your first walk, another session between breakfast and lunch, and a 3rd session in the afternoon. Now, the afternoon after your surgery, I like to do a group class. Where we are on that right now, I don't know, but you'll get a good post-op exercise class. That's for the caregiver as much as it is for the patient. So whoever your partner is in this, invite them to be there the afternoon of your day after surgery, and we'll go over it together. at least with the two of you, and perhaps with more people depending on the timing, and I'll give you written instructions for that. Now, the occupational therapist will also see you the morning after your surgery. They typically don't see you as frequently as physical therapy, but who knows? It all depends on your particular needs. All right, so like we said earlier, it's typical that you'll stay for 2 or perhaps 3 days with us. That is in our acute care, so the hospital part of our hospital. And that does include a lot of people coming in and out of your room frequently, especially the first night. They'll be taking vitals, they'll be drawing blood, they'll be checking to make sure that you're breathing well, and all of those kind of things happen, and those are all for your safety, okay? So the nurses and the CNAs are in charge of a lot of that, okay? Like I said a couple minutes ago, they'll be drawing blood. And remember, the vampire cannot come out during the daylight. They must draw your blood in the middle of the night, okay? But I'm sure they're completely quiet. The reason is because that gives the numbers for your labs for the doctors when they arrive early in the morning. So they've got to get that a few hours ahead of that, okay? And of course, if you have any difficulties, your nurse will be in touch with the doctor. Okay, now for the sad part of the tale, there will be some pain. Pain is a normal part of the process. This is a remodeling project. We're going in there, we're cleaning things up, we're changing parts out. So yes, there is going to be some pain. Pain, however, is a very individual thing. So how you're going to react versus how the person the week before reacted could be entirely different. Could be different. You may talk to people around town who've had it done, and one of them had a lot of pain and somebody didn't have any. Well, that would be unusual, but at any rate, you're different. Your experience is individual to you, and our job is to help you through it for what it is for you. You're going to have a lot of people ask you, nurses in particular, to rate your pain on a scale of 0 to 10. 0 meaning, I don't have any pain at all. 10 meaning, oh my God, someone just ripped my leg off and I need to be somewhere like an ED right now, okay? I have a hard time believing somebody's having 10 out of 10 pain when I wake them out of a deep sleep and they seem completely calm and they tell me, oh, my pain's so bad, there's no scale high enough, it's like a 17. And it's like, interesting. But remember, that's how the scale is supposed to work. We would like to keep you in the 1 to 3 range. When you get in the 4, 5, 6, it's like, oh yeah, okay, we need to really do something. 7, 8, 9, 10, okay, let's wait a little bit, let's let some meds do their work, okay? It is, however, unrealistic to expect to have 0 pain. I do have people once in a while who will say to me, you know, I can feel the difference. I can tell that this joint is solid, and what I feel is some soreness. And I'm like, yes, that's great. That's exactly what we're talking about. We're talking about pain to a large extent that's like a heavy workout. Things have been stretched and pushed and pulled. There's going to be inflammation, there's going to be pain, but it's going to go away, okay? It's not going to last forever like this achy pain you're having at night that's waking you up. We do anticipate keeping you comfortable enough that you can be up with us and participating. Okay, but you need to speak up too. One of the things that I like to tell people is it's really important to ask your nurse, is my pain medication arriving automatically or do I need to ask for it? Because you might have a couple of different types of medications scheduled and you don't need to lie there in agony and just think, oh, I've got to endure this until it arrives. It's possible that you might need to ask. So that's one good thing that you can use that call light for. And there are other things too, like physical therapy. We're part of the whole process of eliminating your pain by getting you up and moving. That doesn't mean that we're going to move you constantly all day long, because that goes counter too. Okay, so now one of the beautiful pain mechanisms that we use here at Jefferson is what's called a cocktail. Okay, it's a wash of all kinds of things that the pharmacy concocts that all end in Gesic, okay, which tells me, oh, cool, this is really good, or cane rather, it reduces your pain, okay, so lidocaine, Novocaine, all those kind of things mean, oh yeah, we're gonna get rid of your pain. So they make this brew of stuff, and your joint is bathed in that before they close it up. okay? That's giving you about 24 hours of really good pain relief that allows us to get you up and start moving. However, it also may give you a little bit of overconfidence. So people will say to me the afternoon after their surgery, oh, you're crazy. I'm perfect. I should go home now because I'm not having any pain. And I'm going to be like, whoa, hold on. Let's talk about this again tomorrow, because it's giving you a little bit of a false sense of security. So during that time frame, things will be transitioning. There will be more oral meds going in, those kind of things. But what we do in the first 24 hours is in being mindful of that cocktail. So I won't say, sure, it's okay for you to go run around the halls as much as you want. I'm using my professional judgment to say, a little bit at a regular basis. Let's not overdo it and get ahead of ourselves, or you end up hating me 2 days out, okay? Now, a lot of the medications that they use are pharmaceuticals. Some of them can sometimes be narcotic, but they're for short-term use, okay? So we need to control your pain so you can endure this and participate and have the best possible outcome. That's why they use them. Now, there are some side effects to narcotics that we need to keep in mind. You might be drowsy, you might be itchy. So if I come in and you're like, wow, I don't know what kind of laundry soap you use, but it doesn't agree with me, my brain's saying, probably it's not the laundry soap, it's the medication. And the nurses will typically have an order to give you Benadryl in that event, because we don't want you scratching holes in yourself, okay? Nausea can be. So I want you to remember, if you're being given medication at, say, 4 or 5 o'clock in the morning, you haven't eaten since the night before, ask for some crackers, pudding, whatever they can give you. Get something in your gut to go with that, otherwise we can have some gut problems, okay? Not uncommon for your blood pressure to run low for several hours or a day or even more than that. So we'll be monitoring vitals, being aware of that. That may also hold back some of your hypertensive type medications that you might normally be on, but nurses are well aware of that and will be managing that with your doctor. The real ugly one is constipation though. Okay, so narcotics, in addition to dampening the pain response, will actually slow down your gut motility. Part of the reason I get you up in the chair, part of the reason we get you up and move you and walk you really often is we need to keep things moving through, okay? So narcotics do slow it down. If somebody wants to bring you something as a nice gift in the hospital, have them bring you fresh fruit. That will help, okay? Now, narcotics will also often mess with your head just a little bit. Remember that. Think about that ahead of time. That's part of the reason we don't advise you to get up and walk around on your own, because you may wake up in the middle of the night, think you're at home, completely forgetting that you have things attached to yourself, trip and fall, or get lightheaded. So when I see you the afternoon of your surgery, I'm going to explain to you all the things that you have attached to yourself and when they're going to come off. So you get an idea of, oh, okay, I have these things squeezing my legs. Those are good. They help prevent blood clots. But I've got a drain, or I've got this dressing. And all those things are important to know about. We don't want you walking around and pulling your IV out. All right, so there are other things we do for pain. You're going to come upstairs. Certainly if you have a knee done, and maybe with a hip, with an ice machine that actually becomes your ice machine that goes home with you. We'll show you how to use that. Super easy to operate. Icing is a huge part of pain control, but also reducing inflammation. Now, a good thing to do ahead of time is to freeze some of the like 20-ounce reusable water bottles. You can put those in your ice machine at night in lieu of the ice cubes, and they'll actually give you longer in between replenishing. So that's a nice thing to do for your caregiver. They won't have to get up every 2 hours and be able to get 4 or 5 hours of sleep instead. Also some elevation, massage, all kinds of different techniques. If you've had good success with something for pain in the past, share it with us. We'd like to use that on you if we possibly can. We can't burn candles in the hospital, but we can do a lot of things, okay? Nursing is going to be all over your bowel protocol. giving you stool softeners maybe, or prune juice, Miralax, mag citrate, all those kind of things. They are really, well, we all are. We get excited when you poop, okay? So we want that to happen before you go home, and they'll make sure that that happens, okay? Blood pressure, of course, will be taken regularly, as will readings for your oxygen. We want to make sure you get enough oxygen to run this big computer up here in your brain. If you have sleep apnea, you use a CPAP machine at home, please bring that with you. Our respiratory therapist will be oh so grateful. That's important. Okay, now, the risk of blood clot is higher for about 4 weeks after surgery. So there are a lot of things that are done, not the least of which is getting up and moving, okay? But you're gonna come up from surgery with those lovely and very difficult to put on stockings, the TED hose or compression stockings that you've seen on people. Those are gonna be used most likely for about 4 weeks. They will be using aspirin for most people for anticoagulation, unless you're already on something like warfarin or Coumadin or Lovenox. Those squeezers that are going to be on your legs that are called SCDs, and most people really like them because it feels like a nice massage, will be used as well. So various different methods to help prevent the risk of blood clot. Now, we're going to talk about your dressing. Okay, I have a packaged one here, and there are some various pictures up there. This is a negative pressure dressing. Okay, best dressing I've seen in any of the facilities that I've worked at where we do joint replacements. What this does is it has a little pump that's attached here. Let me see if I can find the picture on the next slide. It looks kind of like that box at the top, okay? It attaches to a little pneumatic tube and puts a little bit of light suction through the dressing. If you could hold this, you could see what I was talking about. But this is basically a dressing that would go over the knee, like this, or the hip here, and then anything that comes out of your incision is drawn into this dressing, okay? There's a little, like I said, the little white box is at the top, and it has a little light that blinks green in the OK square, which you can see up here at the top. Doesn't look exactly like that anymore. And that means it's functioning properly. It's designed to last for about a week. In a week, it's going to either not have a light on at all, or it's going to show you a red light. At that time, it's ready to come off. So there's two things you can do. One is you can find the outer layer, so it's a clear like Tegaderm layer, and peel that whole dressing off along with the pump and the tube and throw it away. Don't be squeamish. There's nothing to look at there because there's no stitches or staples. It'll look great. Underneath this, there's a black little mesh layer, which is an antibiotic mesh. You can leave that on, and then you can take a shower. Until that time, when this is on, no shower. If you don't feel comfortable, you can, and this has gone off, you can just take a scissors and cut the tubing as it enters the dressing, but then you still can't take a shower. A couple days later, when you go back in and you see Jordan or Randy, one of our PAs, they'll take it off, and then you can take a shower. If it was me, I'd be ready to take a shower. Okay. We'll be looking at this dressing while you're in the hospital. If it's accumulating much, there's always a second one, and they'll change it before you leave. But for the most part, this stays nice and clear. Don't worry if there's a little bit of, it looks like blood there, a little drainage. That's a-okay, all right? If it fills up, then that's another thing we'll talk about. But basically, the lights go off, it's ready to come off, as long as it's in the 7-day range. If it goes off after 2 days, then we got a problem, okay? Don't worry about covering it with anything else. When you get in the shower, though, don't be scrubbing either. Let the water run across it incidentally. Pat the area dry, and you're good to go. That actually helps with the healing. But no tape, don't add anything to it. You don't need to add vitamin E, anything like that. Initially, just leave it alone, okay? Now, if you found that you were having a lot of drainage, it smells bad, you're running a fever, you don't feel good, the dressing is loose, you're having more pain, any of those kind of things, call orthopedics, okay? Prevention of blood clot, activity and walking. Take your medication. Pretty simple stuff, do your exercises, okay? If, however, let's say you wake up one morning and your calf is just gigantic, okay? It's not from exercising. The leg looks funny. It's tender. It's red. It might be really hot. That's a trip to the emergency department, okay? We need to get an ultrasound on that, see if you have a blood clot, okay? But get up and walk. Shouldn't happen, but just be aware. If you saw those kind of things, that would be, yeah, let's get that checked out. Blood clots aren't a scary thing unless we ignore them, okay? Now, other things that might cause you to get a little bit excited, if your leg changes position, you know, foot's hanging out the back instead of going towards the front, that would be a problem. Not going to happen. If you can't put weight on your leg, okay? If your leg is suddenly tingly or numb and it hasn't been. Now, right after surgery, particularly for a knee, it's not highly unusual for your foot to take some time to come around. Part of that is because everything is so superficial here that when it's really swollen, the nerve that comes right down here, the peroneal nerve on the outside of the leg, will sometimes be irritated and cause you to not have normal sensation and motor control of that foot right off the bat. Usually that resolves in a day or two. We'll be all over it. Don't get too worried, okay? If you take a little bit of a tumble, that happens, please let orthopedics know, okay? If you twist on it, I've had a couple people who had a near miss, didn't go down to the ground, but thought they were okay, and then found out later they actually tore something and put it off for a month. Because of course you were still having pain at that point, so you figured, oh, well, I'm okay. I'm still having pain, but speak up if something goes a little bit funny, okay? Or if one leg seems like it's really long all of a sudden, I would be worried about that too, okay? Just back on the fever or the infection part of things, if you start to run a fever, you have that foul smelling. Now, oftentimes for people running a low-grade fever in the evening, they're going to send you home with this little breathing device. It's called an incentive spirometer. Plastic, has a breathing tube off of it. Because you're not up and moving as often as you should be or would ordinarily be, using that breathing device is really important for keeping your lungs expanded. So take that home, continue to use it 10 times an hour like we're going to show you in the hospital so that you keep your lungs expanded. Because oftentimes those low-grade fevers are more related to this than this, okay? But if you were to develop the fever, the chills, foul-smelling drainage, any of those kind of things, it's really red, you get blisters around it, you need to let orthopedics know so they can take a look at it. Again, we've talked before about having somebody with you for 24/7 for the first week. I like to affectionately call them your quality control officer. They're making sure you stay on the straight and narrow with your meds, your exercises, that you're not driving, you're eating. Their primary roles are going to be the cooking, cleaning, shopping, and transportation. You should be able to take care of everything else. They can sure check in, make sure you didn't take meds 2 times really close together or something like that, but for the most part, you're going to move yourself. Before you leave the hospital, I'm going to want to make sure that you can get in and out of bed on your own, up and down from a chair, walk adequate distances for being home, and do stairs if you need to. Get in and out of the car. All of those kind of important things. Normal obstacles. Now, if you're a liveaboard and you live out at the end of the marina, that can be challenging. You have a rope ladder at home, something like that, tree house, then it makes my job a little harder, but we'll work with it. And then we'll figure out where do you get to go. Hopefully home, come out for outpatient therapy. Now, if you went home and you were having home care, they would see you 2 or 3 times a week, probably 2. It's pretty much the same for outpatient. The nice thing about home care is that usually it involves a nurse. They can do blood draws to check your clotting mechanisms and things right there at home, your incision, all that. But very few of our people actually qualify for that. We talked a little bit before about the swing bed program. Again, that's kind of subject to availability, very much so, and can't be determined until you're actually in the hospital. We like to keep everybody out of nursing facilities if at all possible. Your best bet is going home, being in your own flora and fauna. The thing is, if you needed to go to a skilled nursing facility, you would have therapy every day, just like you would on the swing unit, really 6 days a week. But for most of you, you're not going to need that, okay? Outpatient is the preferred thing. You will need a chauffeur to get there. I like to see people set up therapy close to where you live. So if you live in Brennan or out on the Coil, you don't necessarily want to come all the way to Port Townsend every time you're having therapy. Try to pick a place that you know of and has worked with joints before, close to where you live, preferably not more than a 20 to 30 minute drive, because that's hard on you to sit for that period of time. There are some phone numbers up here that are for our outpatient department. We have a very large and skilled outpatient department right here in Jefferson Healthcare, in the hospital, that you can work with one of our wonderful therapists. I only get to journey with you until you leave the hospital. At that point, we don't get to really see each other. Now, this shows us the types of equipment that you need, and hopefully everyone here is familiar with ECHO. ECHO is a wonderful group here in Port Townsend that will loan you equipment. There's no cost whatsoever to help you through your process. You just borrow it and you return it when you're done. It's also a great place to donate equipment to. So if you have equipment that you'd like to clear out of your garage, they are always taking donations. Now, we need this type of walker right here. Notice the wheels on the front. No wheels on the back. I don't want you to get this one, okay? This looks great. How handy. It has a seat everywhere I go. Oh, it's okay, it has 4 wheels. It has brakes. I hear that all the time. Unfortunately, the wheels on the front are not controlled by the brakes, so it will tip and turn on you despite whatever you're doing. So we want this one, okay? I don't care what's on the back as long as it's not wheels. It can be tennis balls, it can be skis, but no wheels, okay? This particular model is good for an average height adult. Now when I say average height adult, I mean between 5'2" and 5'10" to 6 foot, depending on how tall you stand. So if you're in that range, ask the people at ECHO for that. If you are over 6 feet, you need to look for one that has dual wheels on the front. That determines that it's a bariatric walker, okay? Not necessarily for your weight, but for your height, you might need that. Or if you weigh over 300 pounds, then you want one of the ones that has dual wheels on the front. Now they do make some youth height walkers. They're a little harder to pick out because they look just exactly like this one, but it's a little bit shorter for people who are under 5'2". So you can actually ask them if they know of any that are youth height if you're under 5'2". And then you'll need a regular single point cane. So any of these jobbies right here, okay, pick whatever kind of handle fits your hand the best. You do not need the fancy quad cane. It's hard to keep all 4 on the floor with that. That's great for people with strokes, but not necessary for a joint replacement. So regardless of whether you had a hip or a knee, I want you to get a walker and a cane. All right, now, in the bathroom, we talked about this a little bit before. If you're having a hip done, you're going to need a riser. Now, it could be like this. However, this unit is really nice, okay? This is what's called a 3-in-1 commode. This one is super versatile, which is why it's called 3-in-1. So it could be a commode beside your bed. And these legs are adjustable, by the way. So they go for any height of person. And with this bucket underneath your out, it can also sit over the toilet and become like this, except it's not attached to the toilet. The third thing it can do without the bucket in is become this and be a shower chair. Okay, so it has 3 really nice uses, and as long as your caregiver doesn't mind emptying the commode in the morning, if you're a frequent flyer to the bathroom at night, this can really increase your safety and confidence at home. So I know ECHO has lots of 3-in-1 commodes, so that's never a bad deal. Even if you don't use it, it's easy enough to return. For your shower unit, This is a shower chair for a walk-in type shower, step-in shower. This is a bathtub transfer bench. So if you're showering in a tub, this goes over the outer wall of the tub. This part sits inside, so you can sit down and slide in. And those things are all practiced with you with OT when you're here. Okay. So there are a few other OT devices as well. This is one of them right here. This is the sock donner right here, and you'll see how the sock is slid over this part of it, and then that's put on the floor. Your foot goes in the top, and then you pull on the handles to put your sock on. And they'll practice that with you. Okay. Other things, this is a long-handled sponge, kind of like the one that's up there, which is really nice for reaching toes and backs and things when you're sitting down. This one right here. Now the reacher is super nice for everyone, whether you're having a hip or a knee or just have trouble reaching stuff because you're short like me. This is nice for picking stuff up off the floor, reaching stuff up that's, get those cobwebs off the ceiling. And then you also have the long-handled shoehorn. And I guess I didn't bring a dressing stick, but that's another thing that can be used as well. So those are OT's toys that will help you make your life easier after surgery. Okay? Now, various points along the way, you'll be given some exercises. I'm going to make up a little packet that has a little ball and some bands and things with the home exercise program for before surgery, which will be another program you can watch and do the exercises too. And then we'll also give you one afterwards. So feel free to share those with therapists beyond here. We will all work from pretty much the same skill set of exercises with some variations, so it's always good to look and see what people are doing. So normally we would have questions if we were live. At this point, we're providing you with my email, and you can email me your questions and I'll get back to you as quickly as I can on that, usually within a day or two. So that is pretty much it. See you soon.